Hi, this is Dr. Shoemaker. I want to talk about what makes a good orthotic. There's a lot of arch supports. It seems like everybody and their mother's trying to make arch supports, or shoe shops trying to sell insoles. The whole good feet store phenomenon of walking in and having non-doctors essentially prescribing. They can do this because they're not prescribing an orthotic as opposed to something out of a box. So it's kind of a guess and by golly approach. What makes a good orthotic, just like any other medical diagnosis, starts with a good exam. And things that we look for here at our office is, number one, what is your diagnosis, and then what do we think mechanically is causing that? So it's real common for people to have plantar fasciitis, and we'll prescribe an orthotic for that, as well as stretches and other treatments. But for the prescription, there are 12 things that I actually make a decision on. Most commonly and easier to understood is, do you have one leg shorter than another? Do you have a history of a neurological weakness? You could have had a stroke. You could have had an injury where you strained the nerves. All of these things have to be evaluated. You can't just say, oh, I've got a sore heel. But that's why you're coming to see the doctor, to make those determinations. So to answer the question, what makes a good orthotic, starts with a good exam so that you get a good prescription. And here in our office, we use a computer scanning device to actually scan your foot. This is done after a gait exam is done. During the gait exam, I'll also put some padding on your feet to see if I can change how you're walking and let you personally feel the change in what I'm trying to see and you're trying to feel. People will usually have a longer stride length if we're getting the diagnosis right, and usually they'll have less pain, and just even in that setting. So when we do the scanning, then I'm going to flip this around here. We make a scan of the foot, and then there are 12 items that I put a prescription into, and then this is used for a 3D milling to make the device. And then this is made of a dense foam rather than hard plastic. Most of my patients prefer the dense foam over the hard plastic. We assess it based on what your weight is, what your activity is. Are you running trails? Are you running on a track, and so forth? If you're standing in one place, you may need to use a different material than if you're not. So anyways, all these things go in with a prescription. I just wanted to make this video so that you don't just go in and get something from someplace and wonder why it's not working. Thanks.